Dear students, in today's lesson 3 of week 3, we are going to discuss the remaining bacterial disease. In lesson 2, we discussed about tuberculosis and cholera. In this lesson, there are objectives. The objective is by the end of this section, the students will be able to list the remaining bacterial disease, identify the causative agent of those bacterial disease, explain the effects of typhoid fever and diarrhea, name their transmission, symptom, and control methods. Let's continue. The third type of bacterial disease is typhoid fever. The bacterium that causes typhoid is a unique human strain of Salmonella named as Salmonella typhi, which affects only human beings. It's a bacterial infection of the intestinal tract that occasionally also affects the bloodstream. The bacteria are passed in the feces and to some extent the urine of the infected people. It spreads through eating food or drinking water contaminated by feces from an infected individual. The symptoms are generally this appears 1 to 3 weeks after vulnerable to this type of bacterium, but it can be carried for a year. The symptoms may be mild or very severe. They may include very high fever from 30 up to 40 degrees Celsius, painful abdomen, sore throat, and headache. Constipation or diarrhea, those are also one of symptoms. As the disease continues, rose-colored spots may appear on the lower chest and abdomen. Spleen and liver may be enlarged. Those are the main symptoms. If it is left untreated, the victim becomes delirious, weak and exhausted, and finally leads to fatality. And its control and the prevention method is by using antibiotics. Antibiotics are one of effective methods to treat this type of bacterial disease, typhoid fever. The patient should be managed. They need to be supplied with plenty of fluids to replace what they have lost, and small high-calorie food to help them replace the minerals and the energies they have lost. To control the spread of typhoid, all the factors which can affect the spread of cholera also affect the spread of typhoid, which includes careful hand wash after visiting toilet, cleaning drink water, good sewage disposal, good food hygiene, and care in eating raw and lightly cooked foods. Again, the last type of bacterial disease we are going to discuss in this lesson is diarrhea. This type of bacterial disease is a symptom rather than a disease. It is a watery, loose feces. Diarrhea infects the intestine seriously. The causative organisms or agents are bacteria, which is Salmonella and Escherichia coli. If it is virus, rotavirus. If it is protists like Giardia and amoeba. So those are one of protozoans mainly affect as a causative agent of diarrhea. The lining of their stomach, small intestine and large intestine become inflamed and painful. As a result, their body rejects and vomits out food, and also the water cannot be reabsorbed by the inflamed of their large intestine, resulting a watery feces called gastroenteritis or acute watery diarrhea. This diarrhea has a way of transmission is eating contaminated food and drinking a contaminated water by having poor sanitation, and its symptoms is violent abdominal cramp and pain, feeling of nausea and vomiting, watery face without blood, slight fever, general muscle ache, and headaches are common symptoms. The final part is about control and the prevention. How we can control is one of a common sense, having good toilet, kitchen, and by having food hygiene, lots of hand washing. It's preventing or by way of combat is washing hands after the use of toilet and before preparing or eating a meal, drinking clean and safe water, washing salad foods and fruit, avoid eating meat and eggs which are undercooked or raw. Students, in this lesson we discussed about the remaining bacterial disease which are known as typhoid fever and diarrhea. Thank you for your careful following up. Goodbye.